We're going to go ahead and get started. I want to welcome everyone to this session from the Health and Wellness Advisory Committee. And we have an expert with us today, and we are so pleased that he's able to join us. We have Dr. David Donahue. He's a board certified internist and a fellow in the American College of Physicians. In November of 2017, he became Delaware's first board certified lifestyle medicine physician. He received his MS in molecular biology prior to attending Baylor College of Medicine. In 2016, he launched the Cure Diabetes program, and in February 2018, he and Karen Smith launched the Be Well program, designed to reverse any Western chronic disease. He's presented this program recently on the COVID vaccine, which was very well received, and we are honored to have this Brandywine High School graduate present this program to our staff. We also have Michelle Scott, a longtime nurse and expert in flu clinics and vaccine clinics throughout the state, and we will look to her for those to answer those questions. She's a float nurse in the district. And we have Alice Ross Biddle, who is also joins us as an advanced practice nurse. She's new to school nursing, but we're pleased to have her in our community and with the Brandywine School District staff. So with that, I'm going to turn that over to Dr. Donahue and let him share his screen.
Super. Wow. Thank you so much for that kind introduction. I don't know where you found that, Beth, but that was a pretty good one. A little over the top, perhaps, but I'll take it. Let's see. We're sharing, hopefully, and we'll get started with the presentation. So greetings, everybody. It's a pleasure and a privilege to be talking to you here today. Yes, I am a product of the Brandywine School District and went to Lombardi Elementary and Burnett and Springer and Hanby Middle School and then Brandywine High School. So I owe much gratitude to you educators and the wonderful work that you're doing at BSD. My wife, Debbie Zarek, is on the school board, and we've been so impressed with all the amazing people. So it's an honor and privilege to be able to do my best to communicate what the science says about COVID-19 and the vaccine today. So mainly we're going to focus on how can we protect ourselves, protect our students, protect our families, protect our loved ones, protect our community. So we'll start with your questions. We had a few questions posed in advance, and then we'll try to go a little bit deep into the science around COVID-19 vaccines. And also, if we have time, we'll get into what other behaviors are known to help protect us, what lifestyle factors would likely protect us. Being a primary care doc and an internist, but also a lifestyle medicine doctor, I'm very much focused on prevention and through healthy lifestyle, which ends up being our best tool for prevention in general. And then if we have time, we'll talk about what's the very best way to beat a pandemic. We'll try to do all that in a half hour. So probably the first question that many of you had, nobody asked this in advance, but is it safe to go back to school? So this is a slide from the World Health Organization presented recently, and their analysis of the research says that there has basically been very few outbreaks reported in schools, despite the fact that many schools worldwide have remained in operation. They do, where they do have an outbreak, it's more common to happen with the older kids than the younger kids, like in the high schools. And in school outbreaks, it's usually the adults introducing it to the kids. So there's not so much kid-to-kid transmission going on. Overwhelmingly, we're finding that your greatest risk is from the other adults at school, more so than the kids. At least that's what the science seems to be saying so far. Also, we found that closing schools turned out to be kind of small potatoes as far as a public health measure aimed at reducing the spread of COVID. So you get much more benefit out of things like closing restaurants and perhaps places of worship, which are like number one and number two, and perhaps gyms. But schools end up being much lower on the list of risks. Another question that you probably have is, when will I get the vaccine? When would I qualify? So I think most of you, being educators, would be qualify as frontline essential workers, which would put you in this phase 1B. So somewhere around mid to late January is when you are slated to get the vaccine, according to Delaware's plan. Now I know it's mid to late January, and most of you have not been offered the vaccine, but I think that's going to be coming very soon. So who should not receive the COVID vaccine? Who should definitely not receive it? These folks are really not allowed to get it. Those who have active COVID-19 would be one. But if you're 10 days out from COVID infection, you actually could get the vaccine, and we don't really have any science guiding saying why you couldn't. Is it harmful to get the shot if you have COVID-19 and don't know it? The answer to that question is no, probably not. And plenty of people have, and there doesn't seem to be any negative consequence. Those who have had severe allergic to the COVID vaccine itself, and since you've never had the vaccine, it's impossible for you to have a severe allergic reaction to COVID vaccine already. Those who have received anti-COVID antibody, the monoclonal antibodies therapy within the last 90 days. So the scenario here is you developed COVID-19, you got sick, you got treated with the antibodies, and that all happened within 90 days. Then you just got to wait at least till the end of the 90-day period. And the worry there is that the vaccine would be inactivated by those antibodies, and you wouldn't get the benefit of the vaccine. Those who had another vaccine within 14 days, and this is just thought to be prudent because if you get a side effect, we know which vaccine to blame it on, is the main concern. And if you get the COVID shot, it's best to wait another 14 days till you get another vaccine. And one indicator we have is that if you're allergic to polyethylene glycol or other polysorbates, then is another scenario where you need to not get the vaccine. But other than that, basically almost anyone else can get the vaccine. So, if you have questions, if there's something particular about yourself, then check with your doctor. But we've really found that most everybody else is safe. So, there's recommendations to use caution if you've had a history of severe allergic reactions to any vaccine, but it's not a contraindication. The recommendation is in these use caution circumstances to wait 30 minutes after the vaccine, to be observed for 30 minutes after the vaccine rather than the standard 15 minutes. But really, that's it. You can get the vaccine if you have a history of multiple allergic reactions. If you're pregnant or breastfeeding, we'll get into that here, but it's considered acceptable decision to get the vaccine in general. And if you're severely ill, again, you could potentially get the vaccine. If you're really acutely ill with high fever and you're just sick right now, it's probably best to wait until that vaccine, till that illness resolves. What about other conditions like Hashimoto's or autoimmune disease or surgical implants, or you're immunosuppressed, HIV? There's no major concern with vaccine safety. There's concern for getting the COVID infection. You don't want to get it. So maybe perhaps all the more reason that you want to get the vaccine. If someone has COVID but does not know it, is it still safe for them to get the vaccine while having COVID? And I mentioned that we think yes is the answer to that question. And it is not necessary to get tested before you get the vaccine. So regarding the pregnancy, this is copied from the CDC, what they have to say about pregnancy. But basically, people who are pregnant and basically people who are pregnant, talking with a healthcare provider may help you make an informed decision. While breastfeeding is an important consideration, it is rarely a safety concern with vaccines. No data are available yet on the safety of COVID-19 vaccines in lactating women or on the effects of the mRNA vaccines on breastfed infants or milk production excretion. But however, mRNA vaccines are not thought to be a risk for breastfeeding infants. So people who are breastfeeding and part of a group recommended to receive COVID-19, such as yourselves, may choose to be vaccinated. So we're putting it in your hands whether you want to get the shot or not. Basically, they're hedging. They don't know for sure because it hasn't been studied, but based on past experience with other vaccines, giving it to pregnant women or lactating women who are breastfeeding seems to be probably safe. And we know that COVID-19 infection is not safe. It can be very deadly. So what if I skip getting the vaccine now? Can I get it later? And the answer is almost certainly yes. And I suspect we're going to hit a point where we're begging people to get the shot so that we can get some herd immunity, and so that we can make this infection, this virus, finally go away. So I wanted to touch briefly, and we're going to get more into the vaccine, but I wanted to touch briefly on where we are with the vaccine right now, with the virus right now. So as of yesterday, the United States has had 23 million cases total, which is getting up there. You think this is a country of about 300 million people. We're getting close to 10% of the country has had the disease. We've had, I believe just today we passed the 400,000 death mark. So somewhat ominous. Right before Joe Biden takes the presidency, we've got 400,000 deaths, with more to come. One piece of good news, we see that the spike from after the holidays finally starting to come down, and let's hope that that comes down. If you look at the Bill and Melinda Gates funded organization called IHME, they have done some forecasting of where are we going to end up with this thing, and they're predicting for the United States we'll end up somewhere around 566,000 deaths. This is obviously highly speculative. It's based on a lot of assumptions, and I don't think they're really taking into consideration some of the new strains emerging, which are potentially more infectious. But let's go with this prediction. Maybe we've got 400,000 deaths. We might be in for another 166,000 deaths. Again, we're not sure. And this is how sort of the daily cases are predicted to play out. So sometime around May, we should really be finally tailing off. And obviously, if we really slack off, then we're going to lag, and we don't really tail off till the summertime. If we really get on it, then we can get relatively low numbers of COVID-19 much sooner. And when I say get on it, I mean continue all the precautions that we're already doing and get vaccinated. So for the world, the numbers are similar. They're predicting about 3 million COVID deaths total, at least by May 21st. Again, dropping off starting around now, and really leveling at a much lower level of daily deaths come May and into the summer. Let's talk in more detail about the vaccine itself. So there's Joe Biden getting his second shot over at ChristianaCare. I think it was a week ago yesterday that he got his second shot. There's me getting my shot and getting bunny ears in the process. Eagerly getting my shot. Here is the data on the Pfizer, the Pfizer vaccine. So this one, this graph is really interesting. Look at this graph. This is basically a randomized placebo-controlled study. So basically, this vaccine has been well studied. It was given, it or the placebo was given to 43,000 people. So everybody got the shot. Out of the 43,000 people, half of them got the vaccine, half got a placebo. And then they just followed to see what happened. So the people who got the placebo are in blue. And we see that with time, they just kept getting COVID. So each little square is a COVID case. And the dark square is a severe COVID case. So we see just ongoing COVID's cases happening at a fairly steady rate. But look at the people who got the shot. Look at that curve leveling off about day 12. And this is after just one shot. So after one shot, day 12, the infection rate goes very low. and with only a single case of severe COVID-19. This is exciting results. Um, and if you look at the side effects, it was pretty mild. And these people were followed for at least 2 months. So the side effects are just pain or redness, some systemic reactions like fever, headaches, muscle aches. Um, and I'll show a little bit more of that data shortly. But an efficacy of 95%. What a fortunate turn of events. And then you look at the other vaccines that have been developed, the other one that's approved now, Moderna, a similar rate of effectiveness. So, and if you look at it compared to other vaccines that are available, much more effective than the flu shot. The flu shot's only about 50% effective. Still enough to help us achieve herd immunity, still enough to save lives, but not nearly as effective as the Moderna and the Pfizer. And almost as effective as our very most effective vaccines like measles and rubella. So we should be jumping with joy. How lucky are we that they were able to produce this vaccine in record time using a new technology called messenger RNA that has this level of effectiveness. I mean, it is absolutely the best case scenario with almost no major side effects. Now, how an RNA vaccine works. So this is, again, like a new technology in a sense. It's been tried before, but never really all that successfully. You basically package this messenger RNA, which is basically instructions on how to make a protein, into a little fat droplet. And you make millions of those droplets, and you inject 1/2 of 1 milliliter into somebody's muscle. And what that does is your cells take up that messenger RNA, follow the instructions, and produce this protein. It's the spike protein of the virus, just the one protein. And that spike protein gets produced by your body, and then your body says, wait a minute, what is this protein? And it makes antibodies to it, and it mounts a little immune reaction to it, and it remembers this invader and says, if I ever see this spike protein again, I am going to latch onto it and take it down. So that's how the vaccine works. What's the ingredients? The Pfizer vaccine mainly has just that mRNA and lipids. It has a little bit of preservatives as far as potassium chloride and sucrose and a couple other chemicals, but in very low concentration, so in tiny amounts. Moderna, similar mRNA and lipids, a little bit of sucrose, a little bit of acetic acid, and then a preservative there. So how could they have done this? Like, how could we have gotten a vaccine produced so quickly? And the answer is they did it in parallel. Well, a couple things. One, there was just a major emphasis worldwide on this with a huge amount of money spent on it. And secondly, they were very clever, and they did what they normally would do in series, they did in parallel. So you've got the research and development. Normally you do that first, and then you wait to see what you learn, and then you don't start clinical trials until you finish that. But they said, you know, the technology's already there. We've tried this before. We know relatively quickly that we want to go after this spike protein. So let's start packaging this up as quick as possible and get clinical trials going. And then in parallel, they started producing it. They said, well, we're going to need tens of millions, hundreds of millions of doses. So let's start producing it before the clinical trials are over. If the clinical trials fail, well, we've wasted some money. But if we're successful, we can save months and months, which means financially means billions of dollars, but more importantly means thousands and thousands, maybe millions of lives, if the quicker we can get this vaccine out there. So all these things were done in parallel. We have been rolling out the vaccine. It's when I gave a similar talk a couple weeks ago, we had distributed 12 million doses. Now we're up to 31 million doses. We had administered 2.7 million, and now we've administered 12 million. So we're moving it out. We could do it. It could be going a lot more smoothly, I agree, but people are getting the shot. 2 doses of the Pfizer vaccine are required to get the full immunity. But again, we show that about day 12, you really get pretty significant protection. So the Pfizer vaccine is 21 days apart. The Moderna vaccine is 28 days apart. And then about a week later, you're thought to have full immunity. We don't know exactly how long that immunity lasts. Best indication is that it slowly depletes with time. Estimates are maybe about a year we'll get protection from the vaccine. It might be something where we have to get an annual shot like we do with the flu shot. I'm just wildly speculating. How effective is Moderna? Well, they did a similar study with tens of thousands of people, randomized, 30,000 people randomized to receive either the vaccine or a placebo, and a very significant benefit. They found the effectiveness was 94%. 30 of the people, of those 30,000 people, had severe COVID. And when they opened up the protocol and looked to see whether they had gotten the vaccine or the placebo, all 30 had gotten the placebo. Nobody who got the vaccine got severe COVID-19 infection. That is to say, zero. So let me emphasize, zero people who got this shot got severe COVID-19. We are talking about, well, basically 100% protection against severe COVID-19. I mean, it does not get better than 100%. Results may vary in the real world, but this is basically the real world. How else can you mimic the real world? I mean, they give you the shot or they give you placebo and they just follow what happens. So the study was well designed, well executed, and really, really good result. Similar kinds of side effects that we saw. These are kind of side effects that you get mainly from revving up your immune system. You rev up your immune system, some people get headaches, body aches, tiredness. So the side effects, just delving a little deeper into that, this is a little bit hard to read, but basically the most common side effects that we had were the headaches, the tiredness, the headaches, the chills, and then the muscle pain. So you'll see that we had about 50% of people got some amount of fatigue, but almost as many people got it in the placebo. So some of the side effects that we get are in our head. I hate to say it, but that's pretty much what we're seeing. And then some of it is legitimate. So we also see that the reactions are more severe the second time around, but nothing horrible. So you'll see, 50% fatigue, and here it was like 65% fatigue the second time around. We had 45% got the headaches, and the second time around it was like 58%. So a little worse. Interestingly, the folks over 55 get fewer side effects, not more. But again, not very severe. Now you say, well, what about severe allergic reaction? There actually has been some data on that, and we've had about 11 cases per million of what we call anaphylaxis, a severe allergic reaction. In 71% of the cases, this happened within 15 minutes of vaccination, so the healthcare workers were available to administer the EpiPen or epinephrine. There were 0 deaths. To my knowledge, there have been 0 deaths from getting the COVID shot, but I'm not a world expert on this, so I have not read every single paper written, so maybe I'm missing something there. But pretty sure very, very low rate of death or severe reaction, about 1 in 100,000. So that is my main discussion about the vaccine. And by all means, put your questions in the chat and we'll get to them at the end. I wanted to certainly emphasize alongside the vaccine. So I recommend folks get the vaccine. My gosh, I mean, it's almost like a godsend how effective this thing is. But in addition, we should continue to do the distancing and the other measures. So these things are known to work. Wearing those masks, you heard it so many times, but it's important. They say 6 feet separation, 3 feet separation has been effective in schools, is my understanding. Avoid the gatherings, avoid those trips if you can do it. Ideally, we can isolate folks as soon as we get wind of somebody has COVID-19. We can isolate ourselves, protect the loved ones, protect people around you, and hand washing, and contact tracing. So here's why social distancing really works. If you can reduce the number of people infected from about 2.5 down to 1.25, at day 30, you've reduced the number of people who've gotten infected from 400 down to 15. I mean, it's logarithmic. So really important to do that distancing. And you've heard much of all this stuff before, um, but it's something we're gonna have to keep reminding ourselves, because after we've gotten the vaccine, a lot of people are gonna say, well, I don't need to distance anymore because it's so effective. And we really do recommend continue some degree of distancing. I will be honest, after you get the vaccine, it will open up your life a bit more because you really have a great deal more protection. Um, just a reminder about masks. There's right way and wrong way to do masks. And as you have students in the classroom wearing masks in all different ways, just like adults, some of them are going to be wearing it right and some are going to be wearing it wrong. They're going to have it down below their nose. They're going to be pulling it off their face whenever they talk. And you just have to keep reminding them, you have to be the mask police, or else that mask doesn't work if it's not on the face properly. And everybody knows the symptoms, but basically COVID-19 is like a cold or a flu, and it can cause anything from sniffles to sore throat, and certainly the cough, but even vomiting or diarrhea. And the thing that's thought to be unique to COVID is the loss of taste and smell. As far as getting protected by lifestyle factors, being a lifestyle medicine physician, being someone very much focused on prevention, an ounce of prevention is worth a pound of cure. I'll just mention a couple things. I mean, we know that people who get more severe reactions to COVID are the people who mainly it's dependent on our age, and there's nothing we can do about that, but we can do something about the underlying illnesses that we face. So age is, again, the key determinant of what's our risk level. And you really, the younger, the better. And this is something that's been found throughout the world in the research. But looking at what factors, what underlying conditions play a role. Another thing we can't do anything about is our gender, but males do have about twice the risk of death relative to females. From COVID-19. Being more overweight increases our risk. So, a little overweight doesn't seem to matter as much, but as we get up heavier, it does get toward doubling our risk of death from COVID-19. Um, we think that a lot of the excess risk that people of populations of color face might relate to higher rates of underlying conditions in those populations, but we're not 100% sure why white ethnicity has been associated with a lower risk so far. It could relate to socioeconomic status, certainly in this country, and so like everything else, socioeconomic status confers a higher level of risk. Type 2 diabetes, having uncontrolled type 2 diabetes does double your risk of dying of COVID-19. So now's the time to really get that diabetes under control, or even try to reverse it, dare I say. Um, Having chronic kidney disease is another known predictor of risk from COVID-19, as is chronic liver disease. Not so much asthma. Asthma is a little bit of an increased risk, but not super dramatic. And things like neurologic disease and autoimmune diseases, and history of stroke, all those things confer more risk from dying of COVID-19. So toward this, we recommend, that healthy lifestyle, and really now's a good time to get your sleep. And I wanted to put a plug in for sleep. If you get the vaccine, which I encourage, you really want to be sleeping well around the time you get it, because you will mount a more robust immune response if you're getting sleep. Our immune system is very much linked to our sleep habits. So you don't want to be getting four hours a night. And I recommend avoid alcohol because that blunts our quality of sleep. But we think that the healthy eating, a more plant-based diet rich in fiber and antioxidants, gives us a lot of protection to our immune system. Keeping active, physically active, moving in a setting where you're not at risk of getting COVID-19. Maintaining connections with loved ones, either remotely through Zoom or et cetera, or in person when you can. Um, and as far as reversing those chronic diseases, we find that diet's important. I think it's one of the most neglected educational topics ever, that we really don't teach much about nutrition, and it turns out to play a really important role as to whether we're going to develop diseases like diabetes or so many other of the Western diseases. So a little plug in there for healthy eating, and you say, well, is it really going to help me now? But you start eating healthy now, and your immune system is going to receive benefits in a matter of weeks. And so we basically find that the more fiber you eat, the less heart disease you get, the less breast cancer, the less diabetes you get, the less dementia, the longer you live. Wanted to put a quick plug in for, and this is a lot of this is speculative stuff. So this is not as important as the vaccine, but um, I think it's worth knowing that green tea has been found to reduce the rate at which people get influenza. So it turns out some of the foods, some of the antioxidant rich foods seem to really play a role in boosting our immune system and protecting us. In Japan, they have this practice of gargling. They even gargle on a daily basis as a preventative measure. And here's some data showing that the daily gargling of salt water reduced the rate of getting sick by 60% in these Japanese children who were studied relative to those who didn't gargle. If you gargle green tea, it reduced it by 71%. So that's dramatic. If I was an educator myself, knowing what I know, I would gargle green tea or decaf green tea multiple times a day to try to prevent any of that virus from getting me. We don't know if this is going to work for COVID-19, but we can infer that it might well, given that COVID-19 is yet another virus. There's the cytokine storm, which we want to prevent. There's evidence that the broccoli can protect, the blueberries can protect. There's a little evidence that vitamin D3 might be protective against COVID-19. The microbiome, the Cochrane Library observes that probiotics were found to be better than placebo in reducing the number of participants experiencing episodes of acute respiratory tract infection by almost 50%, which is pretty dramatic. And I'll just also mention, I mentioned sleep, and they've actually did a study where they purposefully dripped cold virus into people's noses, and some people, they had small amount of sleep and some people had a larger amount of sleep, and they basically saw who got sick and who didn't. So it's an amazing study that they did, and they found that basically the less you slept, the more likely you were to get sick. So get a good night's sleep. We don't recommend sleeping pills. They don't help. And the best way to beat a pandemic, and I'm just going to spend a couple minutes on this. But I think this is a teachable moment. We're living through a pandemic, and it basically sucks to live through a pandemic. I think it's fair to say, if we've learned one thing over the past 10 plus months, is that it is no party to live through a pandemic. This was another pandemic we lived through. It's the 1918 Spanish flu, and it claimed 50 million lives worldwide. So this was a deadly pandemic that makes COVID-19 look like a walk in the park, because COVID-19, recall, we don't know where it's going to end up, but so far it looks like it'll be somewhere around 3 million, maybe a little more, unless it mutates, unless things go south on us. It's going to be a lot less death, a lot lower case fatality rate. So what you don't want to get is a Spanish flu. And Spanish flu was an avian flu. I think it came from chickens. And by the way, the CDC is tracking 19 strains of influenza, these things are deadly. Some of them are over 50% case fatality rate. So as deadly as Ebola, some of these viruses. They are out there. Fortunately, they haven't mutated to the point where they can spread human to human, but some people think it's a matter of time. So I just wanted to mention, when you get one of these outbreaks, and not only chickens die, but people die, and in our chicken breeding operations, these are petri dishes. It's almost, if you want to intentionally breed a new pandemic illness, you pretty much would do what we're doing, which is to spring up tens of thousands of these concentrated animal feeding operations, put them beak to beak, raise 70 billion chickens per year, and slaughter them over and over in these overcrowded and unsanitary environments, and eventually you're likely to get another pandemic. So here I am telling you, in the midst of a COVID-19 pandemic, keep in mind that we don't want another pandemic to happen, and I recommend that we should be mindful of that. So we will summarize with these points. The COVID-19 surge is starting to level off. Classrooms pose less risk for transmission than some of the other social things that we do. You want to wear a good mask. I didn't really talk about a face shield, but I think especially if you have kids who might be kind of spitting in your face, I recommend a face shield as additional protection. COVID vaccines have 94+% effectiveness. It's amazing. The side effects are mild: fatigue, headaches, chills, aches, and pains. Most everybody qualifies to get the vaccine. Anaphylaxis, that severe allergic reaction, occurs about 1 in 100,000 cases. Over 50% protection occurs within 12, at about the 12-day mark of dose number 1, at least of the Pfizer vaccine, and hopefully the Moderna would be similar. Healthy lifestyle to improve underlying conditions and immunity. So there's some things we can do to help reduce our risk, and think now about preventing the next pandemic before it happens by rethinking how we treat animals. And I will stop there.
Okay, thank you. That was really very informative. We have a number of questions that we want to get to, so I'm going to go ahead. I think Alice and Michelle have been answering a few, but the first one really had to do with how long do you have to wait to get the COVID vaccine if you've had COVID?
Well, if you're truly done with COVID, and that is to say you're 10 to 14 days after the diagnosis without current symptoms, then you theoretically could get it right away. And that's, again, provided you did not get treated with the antibody treatments. But if you're still having symptoms, you're not thought to be officially out of the woods of COVID, then you officially still have COVID and you can't get the shot.
So DPH is recommending that if you've had the vaccine or if you've had COVID in the last 90 days, that you please hold off getting revaccinated. They're hoping that you have some build up immunity and that we will give that shot to someone who has not had COVID yet, that is in phase 1A and B.
And we have a couple questions about reactions. One was, is it true that you can have a worse reaction to the vaccine after the second dose, after you've had the first dose? And if you don't have reactions when you have the flu vaccine, does that mean you aren't going to have a reaction to this one, to this vaccine?
Yeah, it looks like we tend to get a slightly worse reaction to the second dose than we got in the first. And there doesn't seem to be that much of whatever reaction you got to the flu vaccine doesn't seem to be very, very predictive of what reaction you might get from COVID-19 vaccine.
And I'm going to one more to Dr. Donahue, and then I think I'm going to put out the big question that everybody wants to know. But how about pregnancy? We've had a couple questions about, is it safe to get the vaccine if they want to get pregnant, and will it affect fertility?
I don't think there's any evidence at all that it would affect fertility. It's just this strand of messenger RNA. I mean, it's probably in many ways poses less risk than taking a daily medication. Like if you were to take a course of antibiotics, there's a chemical that you're introducing in your body that's causing a lot of, and you're introducing in large amounts of that chemical. It causes a lot of side effects. So I would put a vaccine on par with or probably lower risk than taking many medicines. As far as in general, but as far as from a pregnancy standpoint, again, there's not really hardly any evidence out there that vaccines, killed vaccines like this one, could cause much complications with pregnancy or breastfeeding. But that said, nobody wants to come out and say it's safe, and nor do I. So I would say officially check with your OB/GYN and or your other regular doctor.
Okay, thank you. And we do have some more questions that I want to put to Dr. Donahue, but I know we have a lot of questions about when will we be getting the vaccine? And so I'm going to send that over to Michelle and Alice, who've been working very closely in Brandywine School District to see about getting the vaccine and what plans are being made. So Michelle, when are we getting the vaccine for Brandywine School District educators?
Okay, so I'll preface that by saying in the chat, I put in a link to the coronavirus vaccine website for Delaware that has a lot of good information that'll kind of get into details. And also there's going to be a Q&A tonight with Dr. Rattay and Governor Carney. So I also put the link to that, and that'll be a Facebook Live town hall at 7 o'clock. And you are able to submit questions to that. That being said, educators should be getting an email at any time from DOE explaining that we are now moving into phase 1B, which is where the educators fall into. We don't have an exact date of when we're getting it, but the week of January 25th is when it'll be offered. It's going to look 3 different ways. There's going to be public drive-through events, which I'm sure everyone has seen on the media, where you'll pull up, you'll provide your voucher, you'll be screened, and then we'll vaccinate as long as there's no issues with the screening. We do not know which vaccine you're going to get. So it could be Pfizer, it could be Moderna. Pfizer, you'll get your vaccine, you'll get the card with the information on it, and you'll be asked to come back in 21 days to get your second vaccine. With Moderna, same thing, you'll come in, you'll get it, and that is 28 days later is when you'll get your second vaccine. The phase 1B, where the educators fall into, the schools fall into that category, will then be further broken down into 3 stages. So the first stage of educators receiving it will be those over 65 and have, or let me just get this up so I don't tell you wrong. So it'll be 65 and over, or have a high to medium health risk condition, or work with a special population where you can't maintain social distance or wear facial coverings. Then there'll be stage 2. That'll be probably the bulk of our people where you'd have direct interaction with students. So then that includes nutrition and transportation and other staff that are directly in contact with students. It doesn't just mean teachers. And then stage 3 will be those who did not have access to it prior, groups, or who didn't get it in phase 1A. So that's how the state is breaking it down. Follow the website that I put in the link and you'll get a greater idea. So as far as Brandywine School District, I'm not sure if it's going to be the drive-up events, if it's going to be appointments at pharmacies, or a partnering like a federal qualified healthcare center or hospital. Those are 3 different options that they're looking at, and we should have better information on that shortly.
Okay, thank you. That was, that's good. And I guess the information is just about ready to come out, and Governor Carney will give us more information this evening. A question back to Dr. Donahue. A new mutation is being found in California from Europe, though not the US mutation, and it attaches to the spike protein. We're concerned the vaccine might be less effective or potentially ineffective for this mutation.
Right, there's a couple of mutations that are concerning. We don't know to what extent the spike mutated version is going to take over here or not. The one that's more infectious from the UK has not really modified the spike protein. And researchers think that the spike protein modification is minor, so they think that the current vaccine will continue to work. It is possible that we'll have to modify our vaccine over time, but I agree, it's a little bit concerning, and we don't know to what extent the new mutations will play a role or not. But we have no evidence that, as of now, that anything like the vaccine is ineffective in those people.
And so it protects, the vaccine protects you from getting sick. Does it protect from even contracting it and spreading it? So you don't get sick, but can you still spread the vaccine?
It almost certainly is going to protect that, but they don't have proof of that, that it's going to prevent the spreadability, but it's almost certainly gonna, because, and we know from COVID-19 normal infections that people who are asymptomatic are much less infectious than people who are having symptoms. So the answer is probably almost certainly yes.
And so someone asked, and I think you addressed this in your talk, is it safe to say that 1 month after taking the vaccine that we do not have to wear masks?
Still wear a mask, especially around kids. You want to model the right behavior. And official immunity isn't until at least a week after the second dose. So that would be that would be 28 days after the Pfizer vaccine. In practice, it's going to mean that you can do more in your life, like feel safe about giving your loved one a hug, who or such, or go see your ailing parent in a nursing home or in the hospital. So I think it'll open a lot of important doors getting vaccinated.
So let's see. Anybody? Let's see. I think we've answered that one. We've answered the right. Are fiber supplements helpful?
Not as helpful, because they tend to be not the kind of fiber that's most healthy is the kind that's packaged in food. I see a question here. Is there any concern about autoimmune disorders arising from the use of mRNA in the vaccine? Well, apparently you have the concern, and it's not an unreasonable thing to worry about, but I don't think we have any evidence that any such thing would happen. It's theoretically possible, but we're talking about unlikely possibility versus COVID-19 being a known deadly disease. So I feel pretty strongly that the benefits of the vaccine pretty strongly, I mean, overwhelmingly strongly outweigh the risks, in my opinion.
Okay, let's see.
Dr. Donahue, do you want to talk to the fact someone wants to know, can you get the vaccine if you're allergic to aspirin or ibuprofen?
You can. You can. Now, and there's no aspirin or ibuprofen in the vaccine at all. There is a category of people who have lots of allergies, and it is thought that they face a little bit higher risk of getting a severe allergic reaction from the COVID-19 vaccine. And in those cases, it's one of those situations where talk with your doctor, and when you do get the shot, wait 30 minutes instead of 15. Another precaution you could take if you're really worried about getting an allergic reaction is have a EpiPen or an Adrenaclick or one of those needles on hand at home, so that you're always ready to go. And that could protect you against any severe allergic reaction, whether from the COVID vaccine or otherwise.
Let's see if we see something else that we need to answer.
This meeting is
this recording out. We'll be sending the link for the recording for those of you that had to leave, or that someone that may have missed it. We will be posting the link to this recording. And does Brandywine School District have a plan for teachers experiencing potential side effects that would cause us to not pass the questions on the daily screener?
So our plan is that we're going to break the staff out into phases. So we wouldn't, of course, give all the teachers at one school the vaccine on the same day. They would be scheduled out a few days apart, just so that we would not have an effect. The first vaccine, I mean, I've done 9 vaccine pods across the state so far. I haven't had any allergic reactions in the parking lot. You are mandated to wait in the parking lot for 15 to 30 minutes. Those just average people wait 15 minutes after the vaccine. If you've had an allergic reaction to something in the past, they may ask you to wait for 30 minutes just to keep an extra eye on you. You sit in a parking lot and either honk your horn or flash your lights to let them know you'd like somebody to come over and check on you. And we have EMTs and paramedics walking throughout those parking lots. As far as the second dose, I only know probably about 40 people that have gotten the second dose yet, and none of them have reported any lingering effects from it. So if you didn't have a reaction to the first shot, you typically will not have a terrible reaction to the second shot. So you're just going to have to kind of wait and see. But the plan is to stagger the staff that are getting vaccinated.
So there's a question from someone. In the beginning of the presentation, it was mentioned that research shows that adults are more likely to spread COVID in schools rather than children. It is my understanding that children with COVID are often asymptomatic and have minor symptoms that present as cold symptoms. That being said, how can researchers be certain that students aren't the cause of the spread in schools if those children haven't been reported to the Department of Public Health for contact tracing? I'm going to go ahead, Dr.
Well,
Donahue.
I guess I'll say, for one thing, we know that asymptomatic people are less infectious than symptomatic people. But as far as how did the researchers kind of tease apart what was the actual cause? I mean, this was sort of a clinical research setting where they went, they really did investigations and tried to really uncover what is the truth here, like where did this vaccine come from? But beyond that, where did this virus infection come from? Beyond that, I don't know exactly what the researchers did.
And along those lines, well, along the research though, are they continuing to follow the original, the test group with the vaccines that they originally vaccinated?
Yeah, they're definitely still being followed. It's a little tricky to maintain the placebo-controlled trial now that we know it's so effective. So I don't think there might be a small percentage of people who continue to stay unvaccinated, but as far as long-term consequences, if anybody's identifying long-term consequences so far, that has not yet been reported.
Okay. And we've had two questions about this, that if a family member that may have health problems wants to come with an educator, will they be vaccinated, or so that they're at home, in their household, will they be able to be vaccinated with educators? Michelle, do you know that answer?
Can you just repeat that for me?
Well, family members of educators and the family members may have health problems. Will they be able to be vaccinated when the educators are vaccinated?
So right now, the state will be vaccinating anyone over the age of 65, and it's going to be by scheduled appointment. There's going to be a link. I believe the link may already be live on that site the link that I sent.
Tomorrow.
But no, if like I got the vaccine, no one in my house is eligible, even though I have people with underlying health issues in my house. No one else was eligible to get that vaccine. They will just get put in with whatever category they fit into according to the state guidelines. So yeah, we're not doing family members of the house unless they're over 65. And then that staging will also include people with multiple risk factors. So they'll just have to watch the website to see when their family fits into the category. Contracted staff for the district would be included. So if it's a private duty nurse with a child with special needs, they definitely are eligible. So we will look at everybody that works within the district and see how they fit into the plan. And
I'm not sure it was mentioned that this vaccine is for those older than 18. But one is 16 and older. Which one is 16 and older? Moderna.
I believe Pfizer is 16 and Moderna is 18.
Yeah, I think that's right.
So this vaccine is not for children. This is only for those age groups.
So if there are children in the district or teachers in the district that have children in that age category, we don't know which vaccine we're getting. So it's not like you can say, oh, you're getting Moderna and you are 18, or oh, we have Pfizer and you're 17, I want you to get it. We really don't know which vaccine we're getting. And they would fall, unless they have significant health problems, they would fall into the late spring category for getting vaccinated. The other thing I wanted to mention in that previous question is anybody who tests positive in the state gets contact traced. So as long as the person that's tested positive is a good historian and says, I was in Ms. Jones' class and I sat with Mr. B on the bus, or, if you are a close contact, you will be contacted by the Division of Public Health. So I think everybody should rest assured that with the contact tracing, if someone is in your class and is testing positive, we will notify you if you've been around them longer than 15 minutes, even with a mask on, if that helps.
This is an HR question down there. Would you need to take a sick day if you have a reaction to the shot that prevents them from coming into the school building? We will refer you to HR on that. I don't have that answer. So I believe that we've addressed all the questions. Oh, no, one more. What happens if the state runs out of doses and we are unable to get the second shot?
So there's been a lot of concern, even at the vaccine pods over the weekend, about that second dose. Yes, it looks like the President-elect Biden tomorrow is releasing doses. What the states are doing individually, for the first responders, they are holding that second dose back. As long as there's production of the vaccine, we should be okay. They're not recommending restarting the vaccine if you went later. There's been a lot of questions about if you miss that 21-day window. Right now, it's not advised to revaccinate anybody, just to continue on with the series and get that second shot. Ideally, you want to get the first one or the second one after Pfizer at 21 days. There is a 4-day grace period for both of those vaccines, and Moderna again is at 28 days.
And we are about out of time, and we want to be respectful of everyone's time, but that is a very good point about the 2 doses. And Dr. Donahue, did you want to address that we do need that period of time between the 2 doses, why that's so important there, that they get that second dose?
Well, that's how it was studied, I guess, and we have to get the first immune response and out of the way so that you can get a second immune response. But I think it's less important that as long as you're after that 21-day or after that 28-day period, it doesn't seem to matter as much. It doesn't have to be right on day 21. It could be months later, we think. But my understanding was that they don't go early at all. But maybe that's news to me. There's a 4-day lag period.
4-day afterwards, yes.
Oh, 4-day afterward.
I'm sorry, I did not state that. Yeah, 4-day grace period.
I don't think you can go early at all. So don't go day 20 or day 20.
I think you're right on. That was the way that it was studied, and that was the results that they were getting. So I want to thank all of you for joining us. I particularly want to thank Dr. Donahue for giving us your time to share your information. It was excellent. We've had people have asked us to post the links so that they can rewatch the information. So thank you. And to Michelle, Scott, and to Alice Ross-Biddle, thank you all for your efforts in getting the information about the vaccine and really sharing it with all of us and sharing it with staff. So thank you all very much. Thanks for joining, and everybody stay safe, wear your mask, and stay socially distanced.
Thank you. Take care. Be well. Bye.